Welcome to Alzheimer's MD Live. I'm William A. Van Horn, MD, a medical doctor who specializes in Alzheimer's. Tonight I'm going to talk about something very simple. Is there anything you can do about Alzheimer's? I've been practicing with Alzheimer's patients almost 30 years, but I've been specializing in Alzheimer's patients for about the last 15 to 18 years. And I've seen thousands of Alzheimer's patients, thousands of families, and have had the privilege. It's an interesting field because so many people have been told there's nothing you can do. In fact, when I decided to go back to train in Alzheimer's, I've been in private practice, just general psychiatric practice, taking care of mostly adults and some adolescents. And I also took care of about 20% were geriatric patients. And I actually went back to specialize in Alzheimer's because I was looking at the field, my medical field of mine, and trying to see where is there going to be a really big need. And clearly, with the aging population, there's going to be a need in geriatric neuropsychiatry. And in this field, as a geriatric neuropsychiatrist, I take care of everything from organic depressions, which means the brain's low on chemicals, to advanced Alzheimer's disease. I take care of people with all levels of memory problems, from the very beginning of Alzheimer's to the very end. In fact, I was at a conference about 5 years ago, and it was a conference where all the Alzheimer's experts from around the country were invited, and I was invited from South Carolina. A drug company was sponsoring it. And I was misinformed by my office manager that the reason I was going there is that they were going to help me start some studies, some clinical studies in my practice. So I get out to San Francisco, come to find out they were just trying to get us to give them some input on how to market their new drug, which I was not very happy flying all the way from Myrtle Beach to San Francisco to try to help a drug company market a drug. But in the midst of being there, there were 32 doctors there. Of those 32, all were Alzheimer's experts. 29 were neurologists. 3 were geriatric neuropsychiatrists. I was the only one that took care of advanced Alzheimer's patients that had to come in the hospital. And I was the only expert doing that in the majority of South Carolina. That's one area where the care is really lacking, and you can make dramatic differences as a doctor. And so when I came into my practice with Alzheimer's patients, my background was helping adults who had good memories feel good. So when a patient came to my office, if they were suffering with depression, suffering with low energy, suffering with insomnia, my goal was to get them sleeping all night, waking up fresh, having energy all day, zest and pleasure all day, and getting their anxiety under control. And I knew I was very good at that because I had the outcomes with my patients. So when I started becoming an Alzheimer's doctor, I started looking at the whole picture. So often when a patient who has any level of memory loss, the only concern is memory loss. The problem is the paradigm for Alzheimer's disease has been backwards for the last 20 years, actually almost 100 years. It was about 100 years ago that Dr. Alzheimer's, who was a neurologist, found amyloid plaques in the brain and said, well, that's Alzheimer's. So the only way we diagnose Alzheimer's is if we see there's amyloid plaques. So the research has been focused on getting rid of the amyloid plaques. Well, now the new paradigm is that Alzheimer's disease is not a disease that attacks you when you get old, as such as something comes in and causes amyloid plaques. And it's not the amyloid plaques that are killing the brain. The amyloid plaques are actually the end product of a brain that has been dying over decades. If you understand this paradigm, there's so many interventions you can do to make a huge difference in whether you get Alzheimer's. And then if you live long enough, the number one risk factor for Alzheimer's disease is aging. The reason it's aging is because the longer you live, the more your brain dies. It's just like your skin wrinkles over time. As you know, the older you get and the more sun you get, the more wrinkly your skin gets. Well, the brain's the same way. The brain starts dying about 25 to 35 years old. This is why the football players are in trouble, because they've killed a lot of their brain before they hit 35. So at 35, they may have the brain death of a 50-year-old. But if you live long enough, that you are going to start losing memory. So one place you can intervene is trying to keep your brain alive as long as possible through a series of things, which I'll cover at different days. I'm going to try to keep these to 10 to 12 minutes so you can tune in every night. And I'm going to be doing this 9 o'clock Eastern, Monday through Friday for indefinitely, as long as I have an audience that has questions for me. And I'll try to answer as many questions as I can. So the point, though, is why should you believe me that there's something you can do when all these experts say there's nothing you can do? Well, what I did differently was I started realizing that what we need to do is keep the brain healthy, first of all. Feed the brain. Exercise the brain. Then I realized that things such as low brain energy or a chemical depression or anxiety or insomnia, they actually accelerate brain death. So therefore, if I get someone in, and I call it your reservoir. Reservoir is the brain cells you can lose before you start losing memory. It's estimated to be about 20% of your brain. By the time you hit 75, probably about half the people are right on that verge of losing the reservoir. What that means is you can lose brain cells up to that reservoir, but once you step over that line, you start losing memory as you lose brain cells. So if someone starts losing memory right at that point of the reservoir being lost, and they are aggressively treated with good, safe medicines to heal parts of the brain, raise brain energy, raise a chemical called serotonin, raise a chemical called norepinephrine, make sure they're sleeping soundly, in addition to the traditional medicines to help protect memory, you can see a dramatic slowdown in progression of memory loss. And the goal is that basically I tell people it's like your brain is in a race with the rest of your body. And the problem we have is we're really good at keeping hearts alive. We're really good at keeping livers alive. We treat kidneys really well, but we are not good at keeping brains alive. Well, with the approach that I've taken, and this is with thousands of patients, I had the largest Alzheimer's practice in this country, and I treated a lot of patients, and I saw the distinct benefits that would occur if I actually treated the entire brain. Another concept I like to tell people is when you think about Alzheimer's, that the brain is dying, it's not just the memory center that's dying. The energy centers, there's what we call neural networks throughout the brain that are slowly dying. They're becoming less and less effective. And the reason for that is that if a brain cell gets low on a chemical called a neurotransmitter, that brain cell doesn't fully do its function and it dies faster. So the approach I took was, why not boost the different chemicals in the brain with safe, non-addicting medicines? Let's see what happens. And what happened is that people's memory started staying around longer. I tell people, if you come to me with memory loss, I don't promise to bring memory back, because the reason memory's lost is the brain cells are dead. But if you come to me with most of your memory, I can boost the cells to keep them alive, keep them healthy longer, and prolong the life of your memory. The goal is for your brain to outlive the rest of your body organs. The goal is that you will lose memory if you get old enough, but to keep enough memory around that you don't get disabled by the memory loss. And then the third area, in addition to keeping your brain healthy so your reservoir stays around longer, and treating memory loss early, the third issue is with advanced Alzheimer's patients. My goal for someone, I'm talking about someone who has significant memory loss, but may not even know their name or their family's names. And so they come into the hospital, and typically they'll get in the hospital because they're not getting out of bed, they're not eating well, they might be screaming, yelling, paranoid, whatever, staying up all night, keeping the family up all night. My goals when I see those patients are for them to sleep all night, wake up fresh, be awake most of the day, hopefully 14 to 16 hours, and sleep so the family can sleep as well. And their quality of life is dramatically improved. And I will finish on this. The reason I am doing the AlzheimersMD.org and Alzheimer's MD Live, as you know, I'm not asking for money. I am asking for followers, because I'm hoping if I can get enough followers, I can convince people to open centers and clinics to teach the approach I teach. Because I was just up in upstate New York working in a hospital doing consults. I saw approximately 300 elderly people at some stage of Alzheimer's. I saw one that was treated adequately, not like I treat them, not fully. Of the other 299, they were either not being treated or being treated very inadequately, or even worse, on medicines that were progressing their Alzheimer's disease. That's how lacking that concept is that you can do something about Alzheimer's. Not only can you do something, having treated all ages of patients with all kinds of illnesses of the brain, I can honestly say I make a bigger difference with my Alzheimer's patients than I do with any of my other patients, because there is so much that can be done if it's done properly with the proper medicine by a doctor who knows what to do. So tell your friends about the show. You can get way more detail than I just told you by looking at the Alzheimer's Journey. It's a very extensive series that I put together over 2 years, and it goes into a lot of detail what I'm talking about. But I'm going to try to give you as much as I can every night on Alzheimer's MD Live at 9 p.m. Eastern. Thank you.